The mission of Lancaster General is to advance the health and well-being of the communities we serve. And the importance of that mission is that it's not about just caring for people when they're sick or they've been injured, but it's about how we can help advance health among individuals and among populations.
As time has gone on, we've assumed a greater and greater role in what we perceive to be our responsibility for conveying wellness programs and healthy behaviors to all of our community. And the effort to curtail tobacco use is certainly right at the top of our list. Right after the tobacco focus has been our emphasis on reduction in obesity.
One of my co-workers was coming to the gym at that time, and I said, oh, well, I think I'll just go over and see if I can sign up and work out there too, because I want to lose a good 50 pounds. And I have done that.
At Lancaster General, because we're a healthcare delivery system, we have a firm basis of ethical beliefs that are based really on medical ethics. You can teach people skills, but you can't teach them values. They bring their values there and they want to live them out, but you have to create the environment where they're free to live those values out in a positive and effective way. The concept of every time behaviors came with a vision that we created together as a leadership team between the board and the senior team. And essentially our vision is to create an extraordinary experience every time. And in order to do that, we felt that we had to tell our staff what those expectations were.
I think there are a lot of opportunities in healthcare for employees to make and be faced with smaller ethical decisions, maybe not the big ones that tend to make the news. There's decisions that staff make on a daily basis. Do I cut corners here? Do I see other people cutting corners for speed or efficiencies? We have policies and procedures that are available online to employees that guide those behaviors. And so because they're well distributed, they're well known, and when we're faced with every time behaviors of being accountable, being truthful, being transparent, I think those expectations are inherent in one's decision making.
Doing any type of work that is based on trying to create a culture that is grounded in values is not something that ever ends. It's an ongoing process.
Hey, how are you doing, Vinny? All right, how are you?
My name is Vincent Lagano. I'm a dialysis patient since 2007. If it wasn't for those machines and those nurses, we'd be dead. Simple as that. They treat you like your family, and it's just wonderful. There's a problem, they all help each other out. They all jump right into it and make us all feel comfortable and take care of us. As simple as that.
Lancaster in general really believes strongly that we need to be a good partner to the municipalities and the school districts that we work so closely with. First and foremost, we are users of municipal services. We have very strong working relationships with the school districts, and we feel as a partner that we need to help contribute to their economic vitality and prosperity. So as a result of that, our Board of Trustees several years ago decided that we were going to make payments in lieu of taxes. And we do that at a level that exceeds what our tax assessment would be.
Does it happen often that there's a payment in lieu of taxes of that amount? I tell the other mayors about it, and they look at me with a mixture of envy and disgust. I don't know of any place else that contributes that large an amount, but that's only a small part of what Lancaster General does in the way of being a corporate citizen. A lot of people don't realize the amount of charitable work they do in the way of directly providing services to people who could not otherwise afford those services. I can't recall it right now, but it was a jaw-dropping figure.
If you qualify for the federal poverty level, we provide free care to you. We created that so that our caregivers, our physicians, and our other clinicians working in the hospital environment wouldn't have to in any way pay attention to what the insurance source or payment source is for services.
Another thing that Lancaster General has done is provide tremendous support to the Southeast Lancaster Health Center.
Our mission is to provide care to anyone who needs access to primary medical and dental care. We serve the uninsured, we serve people that have Medicare, we serve people that have medical assistance. It's really anybody who needs primary care in the community. LGH gave us a financial contribution of $2.5 million to help us buy this building and this property, which allowed us to create the 24 medical exam rooms that we have today.
The fact that we are a nonprofit organization allows us to return those funds which were not required for operations of the facility back to the community, frankly, back to programs and projects that we have to further healthcare within the community. So those funds aren't being channeled to shareholders in New York or to Wall Street. They're being kept here in Lancaster County.
It's a not-for-profit enterprise, and people sometimes are critical of the amount of money that they end up with at the end of the year. I've never seen that money used for anything but the public good.
Lancaster County and the people that we serve are very special people, and Lancaster General is privileged to be in service to them. So we're so grateful, and we are very thankful for this recognition.